Good morning,
Good
everyone.
morning.
We are glad that some of you have been able to join us this early in the morning. Hopefully, you've gotten the kids off to school, or you've had your morning coffee, or even a morning walk, or been to the gym. So you're awake and alert and ready. This is a continuation of an ongoing series of different webinars and education. On the right side, if you're new to these webinars with East Valley, on the right side, there's an area where you can chat. I'm going to say hello to everyone and good morning. And apparently I can't spell very quickly in the morning. And so you can see there. Hello, Michael. Good morning. We have any questions you have. We're going to save all the questions till the end of the presentation, and just type them into the chat here, or any concerns you have. Technology is great, and sometimes it works for us, and we hope that you can see us and you can hear us. Good morning, Deborah and Karen. And Emily. Good to have you all here. And that's about all the technical stuff I need to introduce you or talk about. This webinar will be recorded and will be available for viewing within a few days. And any other concerns or questions, please let us know. Let me introduce Dr. Jennifer Nevels. Today she is talking about mold and its mycotoxins, the hidden health saboteur. And Dr. Nevels is a graduate of Southwest College of Naturopathic Medicine in 2003. Maybe some of you know or don't know, but Dr. Nevels and I went to school together. We sat next to each other for 3 years. That's how we became friends. She's a co-owner of East Valley Naturopathic Doctors, and she loves, one of her specialties is women's health. She has developed a passion in the last year, recognizing a need within women with breast implants becoming ill. She developed, as far as I know, the first organized program for treatment, and recovery from breast implant illness. Today, she's talking about mold, one of her other passions, and helping people recover. So we're very glad to have her experience and expertise. And of course, she's a good friend. I consider her one of my best friends. So glad to have you. Welcome, Dr. Nevels. Take it away.
Thank you for that introduction. I am excited to share information about mold and its mycotoxins and how it can affect one's health. And really 2 concepts I want to display today to, one, capture individuals who may not understand what's going on with their health. And this may be because it's mold is affecting someone. The second is to use this as a resource for patients who are undergoing kind of the mold healing program. And so they have a better understanding of what all of that this information entails will be hopefully helpful to them. So let's get started. The next thing I want to share before I officially move forward with mold is that it's hard to stay well today in the world that we live in. It's complex, and at East Valley Naturopathic Doctors, us as physicians think of a multitude of things that could go wrong when someone isn't, at their best. And so here are just some ideas of how we think. Hormonal imbalances can attribute to why someone's not well, GI health issues, which can include candida, SIBO, pathogenic or bad bacteria, parasites. If diet isn't where it needs to be, emotional trauma or stress, adrenal and thyroid dysfunction, chronic viral and bacterial infections, heavy metals and other environmental toxicities, and of course, mold exposure, which we'll go into detail today, Lyme and co-infections, and genetics and nutrient deficiencies. So there are many issues that can affect our health. And in some instances, it's very simple, and maybe 1 or 2 boxes are discussed and achieved, and that brings someone to wellness. And then there are other individuals that are more impacted by a multitude of things. And so again, it's important to explore what those underlying issues can be. And again, for today, we're going to focus on one of the boxes there, mold exposure. So before we go into more detail, let's talk about what are some of the symptoms that someone can present with when they've been exposed to mold. And that includes fatigue, weight gain, cognitive impairment, which means memory issues, anxiety and depression, night sweats, dizziness and balance issues, muscle aches and muscle cramps, headaches, chronic sinus congestion, coughing, chest pain or shortness of breath, asthma and allergies, joint pain, hair loss, skin sensitivity to light touch, excessive thirst, electric shock sensations, and ice pick pains. And so again, there may be overlaps with other underlying conditions, but again, if someone's addressing those issues, for example, like thyroid or hormone imbalances, and they're still not getting better, it could be that this is another underlying concern. So a question may be, well, how am I going to be exposed to mold? And there are three thought processes on our exposures, the first being airborne. So we can have water damage in a building or space, and that can occur from a leaky roof and water in through the house that way, through windowsills, and then through bursting of pipes in the home or building. And then that causes a food source for mold to develop and grow. The second common route of exposure is related to foodborne exposure, and that means that in storage or in growing, nuts, grains, particularly wheat, barley, rice, and corn, grapes, wine, coffee, soy, and spices can develop mold on them, and then we can ingest the mold through eating these different more common forms of mold that can be in our food source, and then that can affect our health. And then we also can have foodborne mold as it relates to the airborne part. So mold gets into the air, it lands on food. For example, an apple laying in the kitchen, then we're consuming that food that has some mold spores on there, and then we are getting mold in our system that way. And then third exposure is through transdermal, which means topical. So if someone is seeing mold on a windowsill and looking at cleaning it up, you can get exposure through the skin, and that can get into the body. And so most common are airborne and foodborne. So let's talk about, well, once we have been in a moldy environment and we've had that exposure, let me further explain, the impact that it can have on the system. And thankfully, there's been a decent amount of research so that we really understand how, this can affect our health. So let me orient you on this table here. In the far left column, we have the fungi, followed by the mycotoxins in the column next to that. And the mycotoxins are toxins released by these particular molds. And then the farthest column to the right is the impact. So what kind of impact these toxins are going to have to the system. And I'm going to pick out the more common ones and discuss it so you kind of understand how to view this. And I do understand that the impact part is a little bit more technical, but I'll break it down for you. So one of the more common molds that we see, or mycotoxins we see upon testing, is the Aspergillus mycotoxins, particularly OTA, also known as ochratoxin A. And ochratoxin A often comes in from, again, airborne mold exposure, water damaged buildings. Some foods can have OTA in there too, but its impact is quite harsh to the system. One, it can affect the kidneys, toxic to the kidneys, toxic to the immune system. It can promote cancer, inflame, and toxic to the brain. It depletes dopamine, so it can cause Parkinson-like symptoms. And it increases oxidative stress, which means it's destroying some of the cells and their normal functions. Another common mycotoxin is gliotoxin, again, also released by Aspergillus, and this also affects the immune cells. It affects the alveolar tissue, which is the lungs, so it can cause more specific damage to the lungs. A penicillin produces mycophenolic acid, which can come up commonly, and this one's really specific to lowering the immune system. And the unfortunate thing about that is that not only are we dealing with the toxins released by mold, but now we're dealing with other opportunistic infections we call, like Candida, that can be present in the system, and that can make us more exposed to Candida in general. And then we have penicillium, aspergillus, and bipolaris. They release dermatocystin, which is cancerous to the cells. It's toxic to the immune system, the liver, and the kidneys. And one mold that we do not want to see is Stachybotrys. And this is the most toxic mold to the system. Its damage is really unfortunate, and it lives in spaces in which once the exposure is gone, it can live in surfaces like couches, and it's different materials. But it's, again, damage to the brain, the immune system, and the intestinal tract is quite severe. And then we have Fusarium. ZEA is the most common. And again, you can see the theme here where it's affecting the immune system, the liver, the blood system. But ZEA is a little bit different, as it affects estrogen. It acts like estrogen to the system. And so it can increase risk for breast cancer and disrupt hormones. I think that's enough about the technicalities of the impacts of the mycotoxins. So where are the mycotoxins found in the body? Well, there's been research helping us understand where these mycotoxins, once we're exposed to, where they actually are housed and live in the system. And they can be found in the urine, nasal polyps, and secretions. So they can live in the sinuses. And the urine, let me go back and say the urine is really helpful because we can test. And so if mycotoxins come in the urine, we can use this as a tool to assess if this is a concern. Then we have identified mycotoxins in cancerous breast tissue, spinal fluid, stomach and intestinal tissue, bladder cell cancers in the brain, and in the lungs. And so there are many, unfortunately, places where mycotoxins can be present. So what do we do in situations where we've either had obvious mold exposure or we have concerns based on symptoms? How do we find this information out? Well, we can do testing. And urine mycotoxin testing is a really wonderful tool to use. Nasal swab testing, I may offer and do it in certain situations. And then we have some genetic testing called HLA-DR. And I'll talk about each one individually. So the urine mycotoxin test, ultimately, there are a few different tests on the market, and this has been a wonderful tool to use. And now that we have a little bit more familiarity of the mold and the toxins that are released from them, you can kind of see the sample report here in someone who had been exposed to mycotoxins. And aspergillus, again, must be in this individual because ochratoxin and gliotoxin are present based on the black lines that exist there. And then we have penicillin, which is released by steromatocystin and mycophenolic acid, which, again, these black lines show that this individual has these toxins present in their system. I should also mention that the mycotoxin test doesn't necessarily reveal when in someone's life they've been exposed to the mold. So this could have taken place, within the last few months or present exposure to mold, but it also can mean that this individual, may have had exposure 10 years ago. So we don't know, there's no timestamp on these tests, but we just do know that the individual is being impacted by mold via these mycotoxins showing up in the testing. And then we have nasal swab testing as well. This would maybe say for someone who has more symptoms in their sinuses, congestion, postnasal drip, chronic allergies. Again, we know based on the research showing that mycotoxins can live in the sinuses and the nasal tissue, that this can be a factor in someone's symptoms. But this test may also discern what type of mold could be there, or bacteria, fungi, and biofilms that may be needed to be treated in a bit of a different way. And I'll explain that once we get to treatment center, but the treatment part of this. But the nasal swab, as you can see exhibited by the lovely model here, it does get inserted into the back of the nasal pharynx so that a good sample is received to be evaluated for. And again, the organisms will be listed based on the test. And then we have the HLA-DR halotypes, and these are genetic tests that can be done. Let me describe a little bit more. HLA stands for the human leukocyte antigen, and these are proteins found around all our cells. Our immune system uses these markers to recognize which cells belong in the body and which cells do not, and it presents the information to the T cells, the immune cells, and then the immune cells should appropriately do away with these toxins or foreigners. Individuals who have the HLA-DR halotypes their immune system doesn't function in the way that it should. And so the individuals carrying these genetics are more susceptible to mold or mycotoxin exposure. And the concern here is that, we can have two roommates living in a moldy house. One individual can be really impacted by it while the other may not. And these genes can suggest why perhaps someone has more of an impact, because their body has a harder time appropriately dismissing the toxin. And so I like to say they're hoarders. They kind of hold on to this and do more. Their immune system does more improper things with the mycotoxin so that they get sick. And we've learned through investigation that, roughly 25% of the population is a carrier of this gene. And there's thought that this number is too low, that it may be even more like 40 to 60%. So we'll see in time what that turns out to be. But this test can be done. Again, this isn't looking to see if we have mold in the system, which is looking to see if someone's more susceptible, to that. And so, again, a blood test could help decipher if this is what's going on. So in individuals that we've determined the mold is indeed a concern and an issue, then we need to enter into the mold healing program. And I've separated them to phase 1 and phase 2. So let's go through the steps together as to why we make the suggestions that we make. And step 1 through 5 are really all done simultaneously. So step 1 is, obviously, we want to make sure that we're not currently in a place of mold. So we need to seek out and remove the source. And again, as I mentioned earlier, someone may have had exposure to mycotoxins, 5-10 years ago, and it may not represent the current time frame. But if someone has high mycotoxins or mold, we need to make sure the individual is living in a safe environment. And so that's why we suggest testing, just to confirm that that is the case. And mold testing in the home, we have that can be done by yourself. Mycometrics offers a test that looks at the ERMI or HERTSMI testing, and more of that. We're looking for DNA of the mold, and so through dust. And then there are companies that are available to also assess whether there is a mold exposure and help remediate if that's a concern. Other thing to consider besides the home is, other places that are visited frequently, like work or school, or parents' homes, things like that, can also, and especially paired with genetics, can be enough to have exposure. And so obviously it's way more challenging to get work to test for mold or schools. And so at the very least, we want to make sure that the home is a safe space to be. So once we have that going on, we want to, our next objective and step is to really bind and eliminate the mycotoxins. And thankfully, there's lots of research to support why this is a really important step. And binders act like magnets, and some are stronger, have a stronger magnetic impulse than others. And so again, binders are binding to different types of mycotoxins and are helping the body eliminate them from the system. And so I'm going to share a little bit of research as far as why we use the binders that we do. And we'll start with the clay binders. And the most common clay binders are zeolite and bentonite clay. And again, now that we have a better understanding of some of the mycotoxins, we can go over this together. The zeolite particularly has more of an attachment, a magnetic connection to aflatoxin, ZEA, and OTA. So it's very often used in individuals who have those mycotoxins present. Bentonite clay is a wonderful binder, as well as it also binds to OTA and ZEA. And then bentonite binds to aflatoxins even in multiple ways, over 90% absorption in studies that have been done. And then we have charcoal and carbon binders. Carbon binder, for an example, is humic acid, which binds to OTA and ZEA. And then charcoal also binds to aflatoxins. And ultimately, fusarium, the mold, we know it produces ZEA, so it's one of the contributing factors, but on its own, it can be bound by carbon and bentonite in small amounts. Chlorophyll is a great tool that we can use as well. And chlorophyll is in green substances, particularly chlorella and spirulina, spinach, parsley, green beans, and arugula. So other greens that we're eating in higher quantities can help have some of the actions. And one, it's a good binder. It's known to be a cleanser. And there have been studies looking at chlorophyll and its effect on aflatoxin. Aflatoxin is really damaging to the liver, and it really helped to decrease the damage at the cell level when utilizing it. So it has many functions, and chlorophyll can be put in a smoothie so that we're getting that on a daily basis during this time as well. There are some information on probiotics and its impact. Saccharomyces boulardii particularly has been shown to remove and bind to OTA and ZEA, as well as gliotoxin and the actual mold, Aspergillus and Fusarium. I'm a little bit cautious when using probiotics, I should say, because oftentimes there are existing digestive issues and I don't want to exacerbate someone's symptoms. So I don't always utilize these things, but these are tools that we can add in at any point. And then lactobacilli strains also have been shown to do similar actions as Saccharomyces, but with aflatoxins and sterimatocystin. Cholestyramine is a well-known medication that is used to bind mycotoxins and really successful, again, at dealing with ZEA, fusarium, and OTA. And usually in practice, I like to combine binders. So instead of doing single impacts of bentonite clay and zeolite clay, I like to use things that have charcoal and bentonite or zeolite clay, have humic acid in there, add a little chlorella. So we're getting a multitude of benefits. And I know not all the mycotoxins were studied, but I do see in practice that even though we have research on a few benefits with the binders and the mycotoxins, it extends way beyond that. As with effort and time, most mycotoxin urine tests clear up. There are some rules when we deal with binders. As they bind the toxins, they also can bind you. And so we want to make sure, because we're letting the mycotoxins leave through the bowels, so we need to make sure that we're going frequently. And so that hydration and a healthy diet is really important. Adding in magnesium if needed to keep things moving, coffee enemas or colonics if we're having struggles here. And again, binders do bind medicines, supplements, and foods. And so we really do want to take it on an empty stomach. So step 3, again, we're kind of building momentum here. We're adding in the binders. We are now wanting to make sure that we're addressing dysbiosis, which ultimately means an imbalance of bacteria and candida and potential fungal overgrowth, not only in the intestinal tract, but also in the sinuses. And so we'll start with the sinus treatment strategies first. So usually when someone has a positive urine mycotoxin test, regardless of they're having any sinus symptoms or not, I am going to put someone on a colloidal silver nasal spray. Because again, we've learned through some research that the mycotoxins, we're going to breathe them in, they're likely going to influence and impact and create biofilms in the sinuses, and so we need to treat them. And colloidal silver is a safe tool to use. I also may use it when I do the nasal swab and it's positive for Marcons or a biofilm. I may suggest using that as well. And why we like to use colloidal silver is because it's antibacterial action. and its ability to handle mold and candida. So it makes an easy thing to prescribe. Now, sometimes there are medicative options that I will advise patients with. I generally will not suggest if we haven't done a nasal swab test, but if we're seeing and someone is extremely symptomatic and we're having a positive test, then some of the examples here, commonly known as beg spray, a compounding pharmacy will make that, and its ability to, again, bust the biofilm, which I don't know if I've really actually gone into that, but that is a network of tissue, white blood cells, inflammatory cells, and again, the organisms that not only affect our sinus cavity, but can affect our whole immune system. So it's really important, again, to really treat the sinuses. The beg spray, again, can help break up the biofilm, and that makes it easier for the other targeted therapies to really penetrate and do away with these organisms that are stealthy and happily present. Amphotericin B nasal spray is something else I may use occasionally for those who have fungi established there and are persisting in not getting the lab results to change. So as far as intestinal health, this is extremely important to deal with bacteria, candida that are, I'm sure, on the rise because, again, these mycotoxins are suppressing the immune system. And so all these other factors that are normally in small amounts, okay, probably not in small amounts anymore, and then also causing their own set of issues. And so herbal options may include berberine or horopedo, oregano, caprylic acid, undesolenic acid, and pau d'arco. And again, I love to use combined herbs, and there are many that I didn't include here, but I think you get the point. Their actions are dealing with bad bacteria and candida. And then sometimes there are medicative options. Each individual is a bit different. So I may suggest fluconazole or nystatin for some who are very symptomatic. And again, some may be candida related, as the fluconazole and nystatin aren't specific to mold or mycotoxins, more specific to candida, where the itraconazole is a medication that can be used as an antifungal specifically. So I may, when someone has several mycotoxins and some very severe ones, where I may use that medication. So step 4. So we've found the toxins, we're dealing with this imbalance and overgrowth of organisms. And of course, simultaneously, we need to make sure that we're eliminating these toxins out of our system. And so just an image here to show a visual on toxins. So the blue circle obviously are the toxins that are entering into the liver. And you can see there are many required nutrients that help facilitate proper detox. And I'm not going to belabor all of the ones that are here, but more of showing the story of we have these toxins, we have phase 1, detoxification, then we enter into phase 2, and then we develop these water-soluble products that the body can eliminate, ideally. And so we either eliminate through the stool, through our urine, and through our skin via sweat. And so we want to make sure, again, that we are increasing the odds that we are going to do this successfully. And so some additional suggestions that may be made when we're cleansing the system of these mycotoxins and mold would be supportive, to the liver and the kidneys. And liver support herbs and kidney support herbs are just some ideas of things that we may use. Again, I like to use formulas, and so I may often use Dr. Shade's liver sauce or Pecana detox kit, which emphasizes detox in the kidneys, the liver, and the lymphatic system. So we have to give a little attention and love to that. And of course, bowel movements are really important. If we're not moving our bowels, and these toxins are just recirculating in our system. And so that may be needed to be addressed individually based on each person, if someone has concerns or issues with bowel movements. Other detox supportive agents or nutrients are glutathione and NAC. And glutathione I think of as just this master antioxidant, and it really helps the body eliminate toxins of all kinds. And the problem with having mycotoxins on board is it's been researched to deplete glutathione. So, and again, this glutathione being in our system acts to rid the body of mold. And so if we're depleted, we need to make sure that we're repleting the system and using it, and usually suggest daily liposomal glutathione. But there are other additional ways to receive it, whether it be through injection, IV, and I'll talk about that in a minute. And then we have NAC. And NAC actually is a precursor to glutathione, so it can be advantageous in that it can help the body make more of the glutathione, but it also has its own benefits and properties that differ from the glutathione, and that is that it can help break down the biofilm that it can exist beyond the sinuses, but also present in the gut. And so it also has been shown to halt oxidative DNA damage induced by ochratoxin A, so it protects the cells from destruction. And so again, for that reason, we may consider adding an NAC. And then there are some other nutrients specific, like resveratrol, specific to ZEA. Again, that mycotoxin that comes from fusarium that acts like estrogen and can create quite a stir of damage in the system. And so resveratrol has been shown to protect the cells from its presence. And then vitamins and minerals, as I showed you in that picture of the liver and all the nutrients that are needed to facilitate detox. We may do testing to discern what each individual's deficiencies are, or provide some basic, support, whether it be vitamins, zinc, or vitamin C. Again, that's all at the discretion of the physician that you're working with. And then the additional detox supportive strategies may be suggested based on the chronic exposure, current exposure. And so infrared sauna therapy is a wonderful tool. The infrared particularly releases toxins, and then those toxins can be sweat out in a heated environment. And so sometimes this can really accelerate the process. And if someone can dedicate, 6 weeks to doing saunas 2 or 3 times a week, that would be just a wonderful advantage. And then we have detox IV therapies. One we've named Detox Defender, as it has glutathione, a bag at the end, and it delivers other important nutrients like selenium and zinc and all the B's, vitamin C and cal and magnesium. And then glutathione IV on its own can be delivered also, again, to really get the cells to utilize glutathione. It bypasses the intestinal tract, so we don't have to worry about absorption, especially for those who struggle digestively. And the same thing goes for our injections, a quick way to receive glutathione. And then usually our super detox injection does include a few other agents that facilitate detox as well. And all of this would not be helpful if we were eating poorly. So we must focus on diet during this time. We don't want to give the immune system, we want to give the immune system whatever it needs to help the body repair. And so that means we need to eat really cleanly during this time. And so what a clean diet to me means is whole foods. We really want to limit the foods that perhaps are more burdened with mycotoxins, like cheese and peanuts, grains like wheat, rye, and corn, coffee, wine, grapes. Maybe we dismiss some of these things. I do know that there are some companies, for example, like coffee, that verify and test to ensure that there's no mycotoxins. So if you have to keep going with that, there are options available. And then organic. So again, whole foods, but we want to make sure we're bringing clean foods into the body, and so organic when possible. Proteins, vegetables, particularly the cruciferous vegetables, the greens, minimal grains, good fats would be included in here. Fiber, to make sure, again, we're eliminating properly chia seeds, hemp, flax. These are just ideas and options that could be added in to improve upon bowel function and regularity. To me, again, I mentioned obviously of trying your best to avoid processed sugar or foods in all forms. It's really suppresses the immune system further, and we don't want to put in all this work and then undo it by eating poorly. And hydration is key. Filtered water, we don't want to bring toxins in by drinking tap water. So please make sure that we're doing that. And some people benefit from doing a food sensitivity test, as that, can help identify more specifically, what food someone may be reactive to. And if we can, have that precise information, then we can apply that as well. And as you're seeing here on the screen, this is an example of one of the food tests that we offer at our office. And it looks at 190 different food sensitivities, as well as the Candida albicans antibody to see if the immune system is really bothered by yeast, in addition to its presence and action. And so the black lines, represent how reactive one can be to food. And then step 6, well, if we're applying all these steps, the next step is retesting and following up. And I should say that usually we require about 4 months. I require 4 months of therapies before I retest, because it takes time. And some people can take up to a year. 4 months is a good time frame to see where we're at with everything. Are the mycotoxins less burdensome now? Are we moving in the right direction? So upon receiving those test results, we want to follow up with our patients, because we need to know symptomatically what's improving and what's not, and kind of pair that with the results. And so when mycotoxins, are improving, then we will likely kind of revisit the steps, 2 through 5 again, and carry on for another 4 months. Then we'll get to step 6 again, retest and follow up. In individuals that are doing amazing, their mycotoxins are gone, they're feeling better, yay you've accomplished what we've intended to do in cleansing your system of the mold, and you're back to feeling well. The third potential factor would be someone whose mycotoxins, whether again they've done this for a year or 4 months, are gone out of the system, but the individual is still expressing symptoms. They're not 100% where they should be. And then that would lead us into the second phase of our mold healing program, which is more associated with our brain regeneration and system reboot program. And so again, these toxins are gone, but the individual isn't where they should be. There are some principles and theories that we have that may have us better understand why someone is kind of stuck and not getting fully better. And again, I'm assuming when we're talking about these individuals that all the other factors that I mentioned that can make us sick in the first slide are ruled out and also fine. And so the idea of the brain regeneration and system reboot program is based on a few premises. One is limbic system dysfunction, and the other is cell danger response. And so let me describe what is the limbic system. The limbic system is responsible for how we interpret sensory data, so smells, taste, sight, hearing, and touch, and to how we code and remember sensory information and how we emotionally respond. It regulates our nervous system and mediates a variety of emotions and motivations. And so the limbic system is working constantly. It's perceiving information all the time, but sometimes the limbic system can become activated when times of danger and threat. And if these times of danger and threat persist, then the limbic system really can become dysfunctional. So let me explain some things that can trigger the activation, even more so the limbic system. It can be physical, emotional, and chemical. And so physical means a motor vehicle accident can be stressful to the system, concussions, abuse, chronic infections that are impacting the body. Emotional would be like a dysfunctional relationship, chronic stress, and again, emotional abuse as well. And then chemicals, what I'm referring to here, and that's chronic mold exposure, taxing the system, and other toxins like pesticides, solvents, and breast implants as well. And so these threats to the system ultimately causes crosswiring of our brain or neuronal circuits. And so the brain starts to distort reactions that are occurring because of this chronic inflammation that the body is constantly receiving. And so the brain is no longer responding in the appropriate ways, and that can distort reactions. And that can appear neurological, it can affect the immune system, and our endocrine or hormone system can be affected by this dysfunction. The other factor is cell danger response. Dr. Nevels is a wonderful physician researcher who concluded that There's evidence showing that most chronic illnesses are caused by the biological reaction to an injury, not the initial injury or agent of the injury. Well, what does that mean? Ultimately, that means that in this instance, the mold, as we knew it to be a factor in someone's health, is gone. It's no longer a threat anymore. But the cells, just like the brain, can get into this cell danger response, this threat. The cells still perceive the threat there, even though it's not there anymore. And so the cell's membranes harden. Normally, cell structures have this lipophilic membrane so that it can perceive information, transmit information, and ultimately, for lack of a better term, shuts down. And so now we've got the brain dysfunctional, the cells in the different areas of the system not responding appropriately. And so people are just stuck. So, well, what do we do in situations like that? And we have at East Valley some brain regeneration and rebooting tools. And I'm going to talk a little bit about each one. Frequency-specific microcurrent therapy being one, hyperbaric oxygen therapy, and neurofeedback therapy. All are great tools, and I'll explain why. FSM for short, again, frequency-specific microcurrent therapy is a non-invasive treatment. It uses microdosing of electric currents combined with tissue and action-specific frequencies to repair and heal tissues and organs. It's a wonderful and non-invasive tool that activates the system, and it's something that we can program the body to respond in the areas that we need it to respond to. And ultimately, FSM works by increasing the production of ATP in injured tissues. And we know ATP to be the major source of energy in how the cells communicate with one another. And it's been proposed that in cell danger response, the ATP is diminished in production, and another cause as to why the cells just aren't functioning. So FSM, we can direct frequencies and treatments to engage, in this instance, the limbic system, the brain, to heal, as we can also engage the cells to release more ATP, be stimulated to really repair. And so this tool is wonderful. And you can see here, we hook up electrodes to wet, warm washcloths, and patients lay in our brain regeneration center. They lay there for an hour and 15 minutes, where our technicians set our patients up. And again, these therapies are delivered to them. We usually like at least 5 sessions, typically once a week. But again, each practitioner is going to make suggestions based on what they know about each individual. And then we have hyperbaric oxygen therapy, which is, as you can see here, again, also at our brain regeneration clinic. And it is pressurized system where oxygen is delivered either through a nasal cannula in the nose or a face mask. We lay there for an hour and receive oxygen ultimately to most of the tissues in the body. And we need oxygen for repair. And you'll see here some of the study benefits. So it greatly increases oxygen concentration in all body tissues, whereas hypoxia, meaning low oxygen, promotes inflammation and infection. So if in a hypoxic state, we're only reinforcing some of the problems that may still be there. It stimulates blood vessel growth to improve blood flow, improves mitochondrial function, improves brain tissue regeneration, cerebral brain oxygen, and enhances memory and mental performance. And hyperbaric oxygen also has an impact, a few different studies showing its ability to reduce fungal biofilm. So it also has some actions against fungi particularly. And there was a study that I wanted to share that included 15 individuals who developed ADD, attention deficit disorder, and slow reaction time after exposure to mold. They were treated with 10 hyperbaric sessions, usually Monday through Friday, took the weekends off 2 weeks in a row. And there was a statistically significant improvement in the areas of ADD and slow reaction time compared to control. So just 10 sessions of a hyperbaric can really be impactful on the cells and the brain. And then lastly, neurofeedback is a technique used to retrain brainwaves toward optimal functioning by strengthening positive neural pathways. And sometimes we will use this as a tool to regain balance in each patient. usually before any kind of neurofeedback treatment is recommended, we always start out with a QEEG. It's also known as a brain map, and it's a tool that's used to evaluate how the brain functions. So it gathers information on brainwave patterns, relationships and interactions between different parts of the brain, and the efficacy or efficiency of communication between these different parts, so that if there's imbalances that need to be corrected, therapeutically and using neurofeedback can be more specific, directed treatment based on the brain map, and that may be a game changer as well. So hopefully this helps you better understand how mold can affect one's health. And if you are an individual who's listening and not feeling well, perhaps this is an area in which needs to be explored. We do have a questionnaire on our website under the forms section, so that you could fill that out and see if that's something that sits an appropriate next step that would be needed to be entertained. And obviously talk to your naturopathic doctor about any symptoms, and consider doing testing. And if you're currently undergoing the mold healing program, you keep going. You can do it. You will feel better in time. So that's it. That's all I have to share today. Thank you for listening. I don't know if there are any questions. Oh, you're welcome, that you may have.
Dr. Nevels, thank you very much for a thorough review. There's been a couple of questions that we want to ask, and we have posted, Dr. Nevels, this webinar is a kind of a summary of some of the writings. There is a new web page on our website that contains a lot of this information, and that can be reviewed. And it's called the Mold Detox Program, and that's under specialties or things that we treat. So that may be helpful or to refer. Now, there were a few questions, and I want to come back here. And so one question that we had was, how do you test for candida in your gut?
Well, the only way to specifically look at candida in the gut is to do a stool test. So there are different stool tests that we offer to see that specifically. So I like to use Dr. Mean's clinic that looks at candida. We also have Dr. Dada's, is it Dr. Dada's?
Yes, they do it. I mean, there's another labs running these tests. Yep, that's one.
Dr. Dada's 360 microbiome testing can help us achieve that information.
Thank you. Another question. This could be a tough one. Deborah wrote or asked a question. Cholestyramine. It's been reports that it can cause mitochondrial damage. I know that was listed as one of our, potential binders.
Yeah, I don't know about that. I can honestly say I don't use cholestyramine anymore. I just have seen such great benefits with using the other binders that I'll have to look into that to see if there's an instance where I may, want to use it again. But yeah, I'm unaware of that.
Yeah, I can, as far as we can tell, and there's still not really known mechanism, but it looks like it causes mitochondrial damage. It could be, and no one knows, but it could be due to its binding effect on fats. It may be causing or losing vitamins that are fat soluble, so like vitamin A, vitamin D, vitamin E, vitamin K. These are serve as antioxidants, which are really important in protecting mitochondria. So there's probably some effect, and it's probably specific to some genetics in some individuals. But yeah, you're right. A lot of us, we don't really use the cholestyramine as much as we used to in the beginning, in the early years.
Right.
Sure. I got caught up in that. So other questions. Will the urine testing reveal the same organisms present as compared to a nasal swab if that's done?
No, they're different pieces of information. So they don't, although they will often be related to mycotoxins or something suppressing the immune system. The nasal swab, I've only had 2 instances where aspergillus has actually shown up in the sinuses. Most times I'm doing the test to see in someone who's chronically symptomatic and seeing if there are a biofilm there. Marcons is kind of this term that's used. It's a multiple antibiotic resistant staph coagulative negative. And this is where if we're positive for that, it's likely, again, a biofilm that's there that is affecting the inability for other things that we use, antibacterials or anti-candidas orally, aren't going to have the ability to penetrate through into the sinuses. And if we're festering abnormal immune cells and infection in the sinuses, it's going to affect us systemically. And so, again, very different piece of information, but yet they are connected to one another. I'm not sure if that helps.
No, I think that I think it was a good explanation.
Well, thanks.
Is the urine testing more indicated in someone who has gastrointestinal symptoms?
Well, it can be. I mean, because mycotoxins are destructive. They live in the gut. They create inflammation. And so if we create inflammation there and then we're suppressing our immune system, then we're having candida and bad bacteria flourish. And now we have food sensitivity. So to me, the dysbiosis, the food sensitivities, the reactions to things can be a deeper layer in that the mycotoxins are present also. And if that's not being treated, such a different treatment when we're dealing with microbiome only and food. If mold's there, then we're adding those binders. We're adding such a different therapy that you're not going to necessarily get better if you have mold still persisting and stirring everything up. So you'll get temporary benefit or not 100% resolution, or at least a significant improvement if the mold is a problem.
Thank you. These 2 questions are tied together. What kinds of molds stay in the furniture? And then 2, is there a way to remove them?
Well, I mean, the particular mold that I mentioned was related to Stachybotrys. So Stachybotrys is the most harmful of molds. Very neurotoxic. And so we know that this type of specific mold can stay in all materials. And so people who have established that Stachybotrys is in their home often need to drop everything and run. And it's the saddest position to be in, because someone's so ill and then they learn such devastating news that, this is a factor for them, that the only way to get well is to get away. And so they usually have to get rid of, again, even clothing, books that can harbor, these toxins and mold. And so that's really the most common one in which you have to move out. As far as other mycotoxins and molds, not to the same degree. So I have seen complete clearance of mycotoxins and mold and improvement in symptoms when someone's still in their house and having exposure to those other things. Anything else to add, Dr. Porter, to that?
No, I think that's, I think that's very clear. Thank you. I don't know, someone asked resources for pets that may be affected. I haven't any personal experience. Any experience for you, anybody you know?
No, but I do believe that animals are, poor things, are absolutely exposed to all the toxins that we are, exposed to. I don't know personally a veterinarian I'm sure there are veterinarians that specializes in this, and so it's hard for me to make suggestions, for animals and what they could receive. But I definitely think that they could absolutely be impacted by the same things that we as humans are impacted by.
Yeah, thank you. I don't know that we have any resources. But again, I imagine that a lot of things that we give our humans, binders, I imagine that, in small doses like we might use in children might be tolerable.
Yeah, like a little bit of clay on the food, as long as the animal's pooping, you don't want to bind it.
But consistent. So best recommendation. Still some other questions here. If if I have mold now and get rid of it, will I always be more susceptible to it?
One more
Like,
time.
do I have to continue on my detox support, glutathione, other things of that nature permanently? Yeah, but this is a good question.
Well, I mean, in instances like that, it could be just, again, the body now has an allergy to mold. The brain has been impacted by the mold, and so we're more reactive to it. And so whether it's a reaction like an allergy reaction to mold, it could be one aspect. The other aspect is if someone's genetically vulnerable, to mold. And so, maybe doing the HLA testing to verify. I would assume that if we're dealing with mold and we're really symptomatic and chronically ill, that the genetics are likely a factor there, which means then you can go into any potential, not to make the brain more paranoid, and more anxiety, but you could go into places that have mold and collect a little bit more. So it may be in some certain individuals' best interest to maintain on a maintenance of glutathione, or if we're traveling, take all the binders and the glutathione to decrease the odds of, bringing on new toxins again, and revisiting, the plan over and over. So yes, there may be in some instances, some individuals that they need to continue with some of these therapies prophylactically, preventatively.
Yeah, and minimally, I think once you've been sort of harmed by mold, I think your alarms and your sort of awareness and your alertness about it. If you walk into a hotel room or you're on vacation or you're visiting somebody, you smell mold, get out.
Yeah.
Don't stay there. So hopefully, you know how much work it took to get better. You don't want to have to go through that 100% again. But yeah, you can always come back and heal and reboot and detox and use all these things to heal very quickly, usually with small exposures. Another question is, how do we test for in our homes? I think you mentioned in your slides about testing, but
Yeah.
What kind of testing would I use?
Well, it depends if you're having a company come out versus doing self-testing. I mean, self-testing, I tend to like Mycometrics or any kind of test that uses a Ermi and Hertzme testing. But the challenge really is in mold testing, because even companies that may be, reliable, well-intended companies may not still pick up mold and mycotoxins. And that's the biggest challenge that I see with patients. It's either really obvious or it may not be. And I've had some patients have multiple experts come to their home, and finally in the fourth company, they find it. And I know this doesn't feel comforting, but that's why I have a hard time. This is truly a hurdle, an obstacle for most. And so sometimes the Mycometrics testing, again, could be a value while, especially if we're really sick and we have lots of mycotoxins. And again, it still could be past exposure. It may not be current exposure anymore as the variable too. But at least the mycotoxin test through Mycometrics is a cloth that you rub over different areas of concern. So kitchens, bathroom. I mean, again, I've had patients, air conditionings leak, and it leaked into the walls. So again, it's hard, but in this instance, we would collect dust and let dust settle, because usually mycotoxins adhere to dust and then they fall to the floor. And then we can get dust in all these particular areas and then have that sent out. And if it's positive, we may not discern if it's the bathroom or the kitchen or what room it is, but at least we then can identify, oh, there's something here. Then you could call in a company to really help understand where it's at. I mean, it's hard. Anything else?
It is a challenge, yes. Another question, kind of a treatment question, and this may be your opinion and maybe varied between doctors, but if a patient has Lyme disease and mold toxicity, is there a best practice to treat one first? For example, first
really good question.
Lyme.
Yeah, I mean, it's a really good question. I guess it depends upon when we find out which one, Yeah. Unfortunately, we if money grew on trees, we do 20 tests all at once, so we know exactly where we're at. And in part, as a practitioner, we don't want it to be a worst case scenario. It depends upon how long someone's ill, and we start kind of the process. And if we're working on gut and the microbiome and diet and people feel amazing, great, they can carry through. But each step as we're assessing what's going on is a step in the right direction, but it just helps us achieve more information. So to answer the question, it depends upon when we find this information out. Someone may come to me with Lyme and I'm immediately like, let's check for mold because there's something else that may be hindering your immune system. And regardless of what protocol I put you on for Lyme, you may not be getting better if you have this obstacle in your path. And so, and that's typically what it may look like. And so I usually will maybe give some treatments from Lyme perspective, but also do a lot of the mold work, because again, it doesn't matter what medications or herbs I'm providing, if our immune system is continuing to be suppressed, we're not getting a wash fully, but we're not getting exactly where we need to be. So I really would highlight mold while providing some support simultaneously from a Lyme perspective. I don't know if you would differ in your thought process there, Jason or Dr. Porter.
Well, I think you have to just build it, piece by piece. And sometimes it's just so much to do. The mold detox along with Lyme treatment. It could be that they're either one of them or overwhelming. I do think that you can just do it little by little. And I mean, I usually will spend a few months working on detox and then start the Lyme treatment. That's kind of my approach. I think you can overwhelm ourselves with too many products and too much treatment. And again, if you overwhelm yourself and you can't do the treatment, you're never going to get better. And so we're trying to be conscientious that we can do the protocols that need to be done, right?
Yeah.
And not overwhelm the system. And again, if you push the system too much, you can get, what we call herxing symptoms, which make you feel horrible. So then you don't want to participate in the program. Go, I can't do it. I don't feel good. And
everyone is so different. You're right. I mean, even some of our patients are very sensitive to a lot of things, and so we have to, do things in small increments. Yeah.
Another great question: are there, is there imaging, brain MRIs that can show mold toxins?
Well, there's a SPECT scan that can be done that can show some areas of concern related to mold. But there are only a few centers here in Arizona, unless that's increased since the last time I looked. I know the Biltmore area had a SPECT scan there. So yes, it can be an informative tool. I don't do that as much anymore now that we have many other tools. Initially, when Dr. Porter and I started getting interested in mold and its impact and implication on health, we didn't have urine mycotoxin testing. We had blood testing, and we had other pieces of information that we tried to, collect to make decisions on. And the SPECT scan was one of them, but I don't do that as often, anymore. And then brain map, can that help us determine if there is inflammation in the brain? And so sometimes I'll defer to Dr. Porter as the neurofeedback and brain map is kind of his wheelhouse.
Yeah, I can say normal, the problem is with the SPECT scan and some of the MRI imaging, which you have to run it through special software, it's a $3,000 charge, which it's hard to get insurance to cover that often. Most people pay out of pocket. So it's why we don't do it. It's cost prohibitive at the moment. In brain mapping, which we do looking at delta, theta, alpha, beta brain waves, you can often see inflammation in the brain, and mold is one of the environmental factors that can create that inflammation. So you can see it often. And you can kind of rule it out sometimes based on the brain map. Again, but in most cases, if you have neurological symptoms, headaches, migraines, neuropathy, nerve tingling, paresthesias on the skin, again, you probably have some, brain inflammation. So the symptoms kind of tell us, we can see that in the symptoms alone, right, Dr. Nevels?
Yes.
So you already know the brain's inflamed very clearly. Can you hear me? Okay.
Oh, wait, hold on. We're trying to connect.
Keeps going in and out today. Maybe one last question. I think I've tried to get to all the questions. If I missed something, please let me know. This one's interesting. I don't know. Can loss of taste or smell return after a mold detox treatment?
I don't know. I guess it depends on, was that connected to the loss of smell and taste. Sometimes, again, our bodies are dynamic and complex, and is it, one more tip on the scale of disease or an imbalance? So I don't know. I mean, it's not a common symptom I see with my patients, as far as a mold specific issue. Again, congestion and chronic symptoms in the sinuses and ears and is one of them. Loss of smell and taste may be associated, but it also could be associated with other things too.
I'd agree. I haven't seen that as a symptom commonly. I'd have to question whether or not somebody had some other infection or COVID or something as a cause. Those are small nerves that affect smell. They can grow back, but it may take time. It takes time usually for those nerves to grow back. Okay, I think I don't have any other questions, it looks like. Great presentation. Again, we have resources and a lot of things that we've discussed today, and even some of the questions you asked are described and again on the website, on the webpage, Mold Detox. One last thing, I know someone asked, is it Dr. Nevels the only doctor that does this? Well, all our doctors do treat mold and see it, and so again, you can work with anybody. We're grateful for Dr. Nevels for creating this slide presentation and helping us write our web page that describes all these things. And what we've tried to do lately is really hand out or provide, again, a really detailed information, listing supplements, products that we use, so this isn't anything secret. Again, it's all over the web, but we want to have a clear format for how we approach this, so and then you can have confidence in what you're doing and the approach that we're using. But thank you, everybody. We're glad that you were with us. Thank you for the questions and participation. And we will see you again in a few weeks on our next webinar. I don't know what that is, so you'll have to wait and be surprised.
Stay tuned.
Thank you, everybody.
Thank you. Bye. Have a great day.